In the fallout from George Floyd's death, tens of thousands around the world continue to rally against racism. It's a cause many are risking their health and safety for, especially in a pandemic. Today, the number of deaths caused by COVID-19 surpassed 400,000 worldwide. Now, there are concerns those large crowds gathering in close contact could spread the deadly coronavirus. Our Jeff Semple takes those concerns straight to the experts.
Thousands have taken to the streets across the country, marching against racism and police brutality, and sparking questions from some viewers about protesting in a pandemic.
Hi, Jeff. My name is Judy Bissell, and I'm here in Calgary, Alberta. My question is, why are people allowed to publicly gather and protest, disobeying public health restrictions, possibly creating an increase in community transmission of the COVID-19 virus?
Bissell worries for her mother, who lives with dementia in a long-term care home. No visitors allowed during the pandemic.
So, yeah, this is a tough one, and certainly there are some contradictions here. Protest is very important, especially in the country that we live in. But yes, when you're outside protesting, there is a risk of transmission, especially when you're in a large group.
Health experts urge protesters to wear masks, keep their distance, and avoid shouting.
People's shouting, hollering, singing, chanting, those are the kinds of activities that from an infected person would actually expel quite a bit of virus.
Hi, my name's Elsa, and I live in Yoho, New Brunswick. My question concerns a proper way to use a community mask all day long.
Public health officials recommend wearing a mask and to avoid touching your face. Easier said than done.
So we have this glow germ powder, which is used in contamination studies to show how germs can spread. I've put some on my hands already, assuming I touched a contaminated surface. And now I'm going to put on my mask like I would before I start the day and go out. Now fast forward and let's assume I'm about to eat my lunch. So now I need to take my mask off. And there you go. And just like that, you can see in the black light where I've touched and potentially contaminated my face.
You put the mask up like this.
Dr. Suman Chakrabarti shows how it's done.
And you can see that I haven't touched my mouth and nose. When you're going to take it off, again, you do the same thing. You wash your hands. You want to touch the loops at the back where you're not touching your face. Close your eyes and mouth. Lean forward and pop it off that way.
He recommends changing or washing your mask after each outing.
My name is Janice, I'm from Maple Ridge, and I'm interested in knowing how well the recovered folks are doing, what percentage were left with medical issues.
We don't have any long-term data on persistent symptoms after recovery.
But in the short term, the hardest hit patients have suffered scarring of the lungs and damage to their heart and nervous system. Around 10% of Canada's cases have been hospitalized, 2% requiring intensive care.
What we do know is if people are sick enough to be in an intensive care unit, it can take a long, long time to recover.
A reminder that even some who survive may never be the same. Jeff Semple, Global News, Toronto.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.